So if it's genetic, does that mean I inherited it from my parents?
That's right. FMF is passed down in what we call an autosomal recessive pattern. Everyone inherits 2 copies of each gene, one from their mother and one from their father. In FMF, you need to inherit a changed copy of the MEFV gene from both parents to develop the condition. This means that even if your parents carry one changed copy of the gene, they may not have symptoms themselves. They are considered carriers. But if both parents are carriers, there's a chance that their child could inherit the changed MEFV gene from both of them, Dr. Magdy explained. Familial Mediterranean fever, or FMF, is an inherited condition, and understanding how it is passed down can be crucial for families. He drew a simple diagram to illustrate the different possibilities. The diagram showed the various combinations of genes that a child could inherit from their parents. If both parents are carriers, there's a 25% chance their child will inherit 2 normal copies of the gene and not have FMF. This means the child will be completely free of the condition and will not pass it on to their own children. There's also a 50% chance the child will inherit one changed copy and be a carrier like the parents. In this case, the child will not show symptoms of FMF but can still pass the gene to their offspring. And finally, there's a 25% chance the child will inherit 2 changed copies and develop FMF. This means the child will experience the symptoms associated with the condition and will need medical management. It's like flipping a coin twice, Dr. Magdy said. Each flip represents a 50-50 chance, just like the inheritance of the gene. Each flip has a 50-50 chance. The first flip could land on heads or tails, and the second flip is independent of the first. To get 2 heads in a row, you need both flips to land on heads. This is similar to the child inheriting 2 changed copies of the gene. Of course, this is just a simplified explanation, Dr. Magdy added. The actual process of genetic inheritance can be more complex, involving many factors that can influence the outcome. Genetics can be complex, and it's always best to talk to a genetic counselor if you have specific concerns. They can provide personalized information and support, helping families understand their genetic risks and options.